The second surgery I would like to talk about is an emergency surgery that I got to see on a baby with an esophageal atresia with a vascular ring. A lot of big names. Well, this particular morning I went to visit my mentor expecting to observe clinic. But a woman went into unexpected labor and Dr. Piper had to perform an emergency surgery. So I'll explain what an esophageal atresia and a vascular ring is. An esophageal atresia is a condition where the esophagus, which is the eating tube and throat, is disconnected and separated. So there's no way for food to go down into the stomach or for like your own spit to go down. So a lot of patients gag and aren't able to grow or function really. The patient also had a tracheoesophageal fistula, which is when the bottom part of the esophagus that is separated is attached to the trachea, the breathing tube that's right next to the esophagus. The baby also had a vascular ring, and this ring is formed by the aorta, which is part of your heart. And the aorta is next to the trachea and the esophagus. And the ring wraps around both the esophagus and the trachea, compressing it and making it hard for the baby to breathe and, of course, to eat. For the first part of the surgery, a pediatric cardiothoracic surgeon worked on the vascular ring. And Dr. Piper just observed, and her fellows also observed and saw what he did. I had to watch through a camera that was on the cardiothoracic surgeon's forehead right here. It was attached to the magnifying glasses they all had to wear, and a light comes out of it so they could see. It's just really cool and very high tech. And this was because the camera is really important. The magnifying glasses are so important because the baby is tiny. It was about 32 weeks along, and most babies have to be 40 weeks along. So it was a premature baby. So it was very tiny, very small, and multiple surgeons were surrounding him. And it was just a very intense surgery. I just had to watch through the screen. But I just love that part about it. It was different from the elective surgeries I saw. There was no casual conversation between the surgeons and the scrub nurses like before. And everyone just looked intently into the baby or the screen that showed the operation. There was a screen everywhere showing the baby's heart rate. But all went fine. After the vascular ring was taken out, the heart surgery was over, and Dr. Piper and her fellows started the operation on the esophageal atresia and fistula. I had to leave early, which is really sad, but the surgery took a very, very long time. But that was a very rare surgery that I got to see, which is really exciting. Next, I also observed clinics, which I explained what was before. I saw multiple cases while observing Dr. Piper's clinic. There was this infant with a tumor in her lung and very worried parents. Dr. Piper will be cutting one side of the lung out because of the possibility of infection and cancer when she grows up. The interesting thing about this was that the patient was expected to be able to grow up and resume normal activities. She would be able to, no asthma or nothing wrong with her lungs. She'll be able to run and dance and do everything other kids can do. This is because the lung can grow and fill up the empty part of the cavity when it's taken out. I just thought the body was such an interesting thing, and it's just amazing how we're able to adapt to, missing half of a lung. There was also this baby boy with no anus, which is your pupil, and Dr. Piper had to create one. This case was so strange and mind-blowing to me. I was definitely exposed to so many different conditions during even just one visit to the clinic. They were all conditions that most people don't know of, and even I wasn't aware of. There were also some very heartbreaking conditions and even more, heartbroken parents. I was just amazed at how Dr. Piper handled all the parents' questions and concerns and how she reassured them of the patient's safety, and she showed that she was very capable without worrying them or looking too much like a proud doctor. I learned that being a doctor isn't just about graduating medical school or being smart. A doctor has to know how to interact with patients and how to let them feel safe. Another thing I got to observe was Dr. Piper's on-call times. And this on-call time is pretty exciting. She doesn't know what to expect, and I don't know what to expect. She takes on the emergency surgeries that comes in, and since they're emergency, you just don't know what you're going to get. And I still remember the first time I saw an emergency appendectomy. Dr. Piper was excited for me, so I was excited as well. And when I saw this appendix after it was taken out, it was in a little bag. It's just so tiny, and I was very intrigued by how such a small thing can cause so much pain. The appendectomy was done laparoscopically, so I was once again able to see the bowel and the insides of someone with a camera. And I liked how a little bag was put in the bowel through a tiny incision, and so that the appendix that was taken out can be put in it, and then the bag will be pulled out. I was expecting them to somehow just pull out the appendix, but I just thought it was so clever that they put a little bag in it and just pull the bag right out. And I just fell in love how surgeries, they're a bit clever, and you have to know certain tricks, and I think that's a really fun part of surgery. My final product is a bit different. It might look simple, and it's a bit harder to understand. You have to know the condition that goes along with my final product. I made a book that targets a bit of like a note that targets patients with small intestinal bacterial growth. First, I'll explain what this is. Small intestinal bacterial overgrowth is the presence of an abnormally high number of coliform bacteria. You don't have to know what that is, but it's basically bacteria in the small bowel. And this causes diarrhea, abdominal pain, bloating, and a loss of appetite. So sometimes they just don't eat a lot, which is bad. Children don't grow. And there's no clear treatment to this condition. The bacterial overgrowth can be anywhere in the bowel, and the small bowel is very long. And pinpointing the location of the overgrowth in children is especially more difficult because they're constantly growing and growing, and the bowel's moving. It's always moving. And there are several tests that can be done to locate where the bacteria is and what it should be treated with. A scope can be put in the stomach to take a sample of the bacteria and to take it out and grow it to see how to treat it. But this is sometimes not as effective because growing that bacteria in a lab is very difficult. It's a different environment than in your intestines. Another thing you can do is a breath test, but both of these tests are not very accurate. Usually the patient is given antibiotics to treat this condition, and in order to prevent resistance of the antibiotics are cycled. meaning one will be used for a certain period of time, then the doctor will switch to another antibiotic, and then after switch back. And so the doctor basically alternates between different antibiotics from time to time. And what I have done is to help these patients is by creating a small note to record the patient's daily condition. And of course, the patients wouldn't do it because they're 2 or 3 or 5 or 6. They don't know how to read or circle or answer questions. So the parents will be doing it, and this is really for the parents, and it's their job. So Dr. Piper does research in poop analysis, which sounds kind of weird, but it's to help treat patients with small intestinal bacterial overgrowth. The poop has gone through a gene analysis, and the genes are compared to normal children's stool or their poop. And knowing the difference might help the patient, so Dr. Piper is doing research on that. So in the note, the patient's parents will record every day what kind of poop the patient's had and the quantity of it, and that sounds pretty weird, but it gets even weirder. There's a stool scale that every patient uses, and it categorizes stool into 7 types, ranging from hard rock poop to liquid ones. And it's really important to record that so that Dr. Piper can treat these patients better. The patients will also record if they threw up during the day or had any abdominal pain, and the amount of sugar intake, and if the kid was on antibiotics or not, and which kind of antibiotics they were on. Now, all these reports will be used to see how the patient is reacting to the antibiotic they're taking, and to locate the bacterial overgrowth with the final goal of healing him or her. Having this note is also important because most of the times the patients only come into the clinic once a month, and of course parents don't remember the patient's everyday condition for the past month. They only remember, 2 or 3 days right before the clinic and how they were, and that doesn't really help Dr. Piper at all. And so I hope that my product will be used to help Dr. Piper treat her patients. I'm in the process of making the note as an application on a smartphone because I know that all the patients' parents have a smartphone. We all have a smartphone. And it's easier to record and send to Dr. Piper every day to help her come up with a plan for the patients. I'm not a tech person, so I'm not really familiar with the app building process, so I'm getting help, but it may take me a while. And overall, I just learned so much from ISM. I had an amazing experience going to the hospital and watching Dr. Piper and being inspired. I love putting on my scrubs and having my face mask and my hairnet. Even though I looked ridiculous, I just love the environment and being there. Through this program, I can tell that I've become more mature and more professional. I am now not afraid to have an interview or to talk to a stranger. I'm excited to speak to a professor and excited to ask them when I go to college to do research and to shadow another doctor at Austin. I would like to thank you all for coming and for supporting me throughout my ISM journey. And I would also like to thank Dr. Piper again for being an amazing mentor. I would like to close my presentation with a quote. All the ISM students have a quote that inspires them somewhat throughout the year and lets them come back to why they're doing ISM. My quote is from a movie. It's from the movie called The Pursuit of Happiness. It goes like this: you got a dream, you gotta protect it. If you want something, go get it, period. I have this dream, a big dream of becoming a pediatric surgeon, and it's a very long and hard road to go. But I plan to just go get it, period.